This is Pharmacology by Mulukano Watu, which, as always, focuses on the role of drugs and drug-related issues for human beings. So today, we will see about the role of water during drug therapy. So, as usual, patient care providers, healthcare providers, students, and researchers will be the beneficiaries from this today. So we will see some introductory points about water and other water-related issues. We will also see why do we take water with medicines and common medication that may dehydration will be today's focus, and we'll summarize how much water should you drink per day. So for this question, there is no a concrete or concise answer. It will vary for everyone. However, the Institute of Medicine of the National Academy determined that adequately hydrated males drink about 3.7 liters of water per day, and adequately hydrated females drink about 2.7 liters of water per day. So we need such amounts of water, at least such amounts of water per day. It varies actually on the gender of the individuals. However, some people may need to drink more water than others. So the consumption of water varies from individual to individual. This depends on factors, on several, like the weight of the individual, the location, the area, or the type of the area where you are living, the activity level of the individual, and the health status of the individual. For example, if you just see the weight of individuals, individuals with greater body weight may require more fluid. They should drink more fluid because over 2/3 of the adult body holds water. So the amount of water that we should drink varies depending on the weight of the individual and even the location. If you just live in a tropical or dry area, you need to drink more water to replace fluids lost through the tuit. Because if you are just in a tropical or dry area, by default, you will just lose more water. So you need to drink water to replace the water that is lost through the hot or the tropical area. Activity level is another factor. For example, if you just do vigorous activity, if you are just running and weightlifting or other intensive physical activity, you may lose water. So you should drink much water than those who don't do physical activities or running or other activities which lead to water removal from our body. Another is the health status of the individual. So individuals some health conditions like fever, vomiting, diarrhea, kidney stone, bladder infections, and even diabetes lead to excess fluid loss from our body. So such types of patients, such types of individuals should drink more amount of water than the rest ones. So why do we take water with medicines? Is another focus, another 2 days focus. What is the need to drink more water with medicines? So mentioned below are the reasons to take medicines with enough water. So for today, we will see 3 main reasons why we should take enough amount of water with our medicines of various purposes. The first is for ease of swallowing, dissolution, and absorption of medicines. For three, under this, we do have 3 points: ease of swallowing, ease of dissolution, and absorption of medicines. So water is a vehicle for tablets. This issue is highly associated with tablets. We do have various dosage forms for drugs, tablets, injectable forms, solutions, suspensions, and other forms of drugs are there. So especially if you just consider tablets, water is a vehicle. It can dissolve such many tablets. So water aids in the movement of the tablet from your mouth to your stomach without letting it stuck anywhere there. So we need water for such purpose, for ease of swallowing. It also reduces choking hazards by sending the tablet down your esophagus without interruptions. If you just take a tablet without water, it may cause some choking hazards in the. So some people have a habit of directly swallowing the pill without taking any liquids. So this could be bad for two reasons. One, if most uncoated tablets have a chalky structure and may stick to your tongue or your throat, and it can leave an unpleasant bitter taste in your mouth as it rubs against your tongue. So unpleasant or bitter taste may lead the patient to just vomiting and other nausea issues. So it can even get stuck in your throat while you are swallowing, and it may cause choking up side effects. So we should develop a habit of taking drugs with enough water. So this is critical. So you should take drugs with medicines for ease of swallowing. So what's important, another point is if you take the tablet without water, it will not dissolve properly. And the entire tablet could pass through the system, the digestive system, undigested without getting broken down. If the tablet is not broken down, it will not be absorbed, it will not be dissolved. So the patient may have passed the whole pill through the face without being absorbed. So the essentiality of the vitality of the systemic use of the drug will be lost anyways. So the drug may be excreted. So we should take drugs with enough amount of water for three reasons: for swallowing, as at least for ease of swallowing, for dissolution, and for ease of absorption. So an undigested tablet means that the body didn't get the benefits of. The second advantage of taking drugs with or medicines with water is to minimize systemic toxicity associated with drugs. So, for example, we do have ample types of drugs taken by patients for various reasons. So, for example, if you just take non-steroidal anti-inflammatory drugs, those are essential for three purposes: for pain relief, to reduce inflammation, to reduce our body temperature, our raised body temperature due to various infections. Those drugs have such advantages. So if we just don't take those types of drugs like ibuprofen, which is under the category of non-steroidal anti-inflammatory drugs, the drug may interact with hydrochloric acid in the digestive juice and irritate your stomach. This leads to stomach ulcers. So normally you should take a full glass of water at room temperature with the medicines. While we take such types of drugs and other group of drugs in general, we should avoid water that is too hot or too cold, which may affect the dissolution and activity or efficacy of the drug. So if you are just not sure about how much drugs, that is the right amount of drug, you may ask the care provider about how much drug should be taken. To minimize the systemic effects or toxicity of the drug, we should take drugs with enough amount of. Certain medications even need to be taken with plenty of water. For example, the medications could damage the kidneys or lead to kidney stones if too much of it reaches to the kidney at the same time. For example, we can take indinavir and other group of drugs. So to just minimize the amount of drug that reaches to your kidney at a time, we may just drink enough amount of water. So the dissolved amount or reduced amount of water, amount of drug, may reach to your kidney. So the damage that is caused by the systemic toxicity that is caused by the drug upon kidneys will be reduced. So water helps to dilute the extra medication so that too much medication does not go to your kidneys at once. So the damage of the drug or the toxicity of the drug on the kidney will be before in the slide before. We should carefully communicate with our healthcare providers. We should do pharmacological and non-pharmacological approaches to reduce this. So the third use of water, or the third reason why should we drink enough amount of water with our medication is to prevent dehydration. So not drinking enough water can lead to dehydration. Dehydration is a state in which the body doesn't have enough water to carry out its normal functions. If you just don't have enough water in our body to carry out the normal functions, we call it dehydration. Dehydration describes a state of negative fluid balance that may be caused by numerous reasons. So diarrhea is assumed to be the most common etiology for dehydration. So this dehydration should be treated at least by water. And to treat dehydration, we do have mechanisms. The major mechanism can be considered as water. So worldwide, dehydration secondary to diarrhea is the leading cause of infant and child mortality. So dehydration results when water loss from the body exceeds water replacement. So drugs may cause dehydration. We'll see. So what drugs? The common class of drugs will be our today's focus. So there are various forms of dehydration. Before going into the drugs that cause dehydration, we can have some forms of dehydration. We can discuss about some forms of dehydration. We have three types of dehydration: isotonic, hypertonic, and hypotonic. The reason varies, the causes varies, and the signs and symptoms also varies. For example, if we just isotonic dehydration, the causes are vomiting, diarrhea, sweating, some burns, intrinsic kidney disease, hyperglycemia, and hypoaldosteronism. Those are the causes. So they should be treated accordingly. So at least we can just diminish such issues by drinking enough water. Some may be caused by drugs. Hypertonic dehydration causes, the second type is hypertonic dehydration. It occurs when water loss exceeds sodium loss. For example, excess pure water loss occurs through the skin, the lungs, and the kidneys. Etiologies for these are fever, increased respiration, and diabetes insipidus. Those are the causes for hypertonic dehydration or hypertonic form of dehydration. Hypotonic dehydration is commonly caused by diuretics. Look, diuretics are a class of drugs which are for various cardiovascular disorders. Which cause more sodium loss than water loss. So what's important is it is characterized by low sodium and low sodium osmolarity. What's essential is we should be it hypertonic, hypotonic, or isotonic. They should be treated accordingly. Otherwise, they may cause imbalance in our body. So if you just see some darkening or strong smelling urine, dry mouth, some sort of frequent thirst, headaches, less frequent urination, and muscle cramps, these are the signs symptoms of mild to moderate dehydration. And they are your body's way of telling you that you need to drink more water. So common medications that may cause dehydration. We should focus on drugs. What are the drugs? For example, drugs for cancer, drugs for high blood pressure, and drugs for type 2 diabetes mellitus may cause water imbalance. Finished. So what's important is if we just know just types of illness or drugs, especially drugs, cause water imbalance. If you are taking any of this medication, it is crucial or essential to watch out for signs you are dehydrated. Certain medication may pull water from the body. Medication by themselves may pull water from the body. Increase the amount of urine, the amount of water in the urine, or cause fluid loss through side effects like vomiting or diarrhea. Very essential point. How drugs cause dehydration? If you are just asking like this. Drugs for cancer, drugs for high blood pressure or blood pressure, drugs for various purposes, bipolar disorders, drugs for headache may cause water imbalance by various mechanisms. One, medication may pull water from the body. Second, medications may increase the amount of water, the amount you urinate. Or medications may cause fluid loss through side effects. Some medications may cause vomiting, diarrhea. If there's vomiting, if there's diarrhea, frequent diarrhea, you may lose fluid or water from it. This is the common medications. The common medications that cause dehydration are laxatives. Laxatives are a group of drugs used for constipation. If you have constipation, laxatives can help bring back regular bowel movements. They are essential for such purpose. Laxatives are essential for regular bowel movements. They are safest if taken for a short period of time. But laxatives are readily available as over-the-counter without the prescription of healthcare providers. So, but you can also get prescription laxatives such as plicanatide, the naming is difficult actually, which treats irritable bowel syndrome with constipation. So, if by speeding up bowel movements, laxatives cause your body to flush out too much of water. This is very essential. Laxatives stimulate bowel movements and increase the bowel movements to the point of diarrhea, which may cause the body to become dehydrated due to the loss of fluids. So we should look for dehydration when you take laxatives for the treatment. The second class of drugs that cause dehydration are oral medications for type 2 diabetes. Oral medications. So diabetes mellitus, we do have two common types of diabetes, type 1 and type 2. So a group of drugs called sodium glucose cotransporter 2 inhibitors prevent diabetes related complications. They're essential for the management of type 2 diabetes, for the management of type 2 diabetes. So these drugs work in your kidneys, ultimately causing more sugar to escape into your urine. As a result, your kidneys will pull water from your body in order to dilute your urine. And in the urine, as I have said, there will be excess sugar escaped into your urine. So the pull out of water, excess water will be used by these drugs. So dehydration. Metformin is another common oral medication for type 2 diabetes. It is associated with GI upset and diarrhea. If there is diarrhea, there may be obvious that you may be dehydrated. So we should drink enough water while we take such types of. The third class of drugs that's the third types of it's better to say the third type of drug is that causes dehydration is Exerdin. Exerdin migraine for migraine headache. We have three types of headache actually. The most and the first one is the migraine one. So we do have medications, be it prescribed or non-prescribed. So this Exerdin migraine, as you can see in the slide there, is a combination of acetaminophen, aspirin, and caffeine. So from the three combinations, caffeine has its own role in treating migraine by its own mechanism, but it has some diuretic effect. So diuretics are a group of drugs that increase sodium and water removal from the body. So it has some diuretic effect, means that you may get dehydrated. So it's essential to look for dehydration when you just take these types of drugs for your. The fourth group of drugs are potassium sparing and thiazide diuretics for the management drugs are used for the management of your blood pressure. If you have just increased blood pressure, you do have various options to decrease the blood pressure. So there are a few different classes of diuretics, including thiazides and potassium sparing diuretics. They have their own mechanism. We can discuss another session about the diuretics, but for today, both types of diuretics are common drug treatments for high blood pressure. So diuretics in general trigger your kidneys to release sodium into your urine, which then takes water from your blood, helping you urinate out excess water. There will be dehydration here. So such types of drugs, whenever we take such types of drugs, we should look for dehydration and we should take the normal amount. Also fast-acting, loop-acting diuretics for heart failure. So loop-acting or fast-acting types of drugs Diuretics are used for heart failure, used for some sort of edematous conditions in our body, for hypertension. So if you have heart failure, you may be prescribed a diuretic, and the one and commonly used is a loop diuretic. So furosemide, bumetanide are two popular loop diuretics. So what's important is these drugs work by flushing built up fluid in your body to relieve stress on your heart. So what is important is the water will be removed. So you may just need to look for dehydration, and you should drink consistently drink more fluid to just replenish. You should continue to drink your healthy normal amount than that maintains your hydration. We do have the diuretics. Various types of diuretics are there. We do have osmotic diuretics. We do have thiazide diuretics. We do have loop diuretics. We do have potassium sparing diuretics. And other class of diuretics are there. We can just, they have their own roles. Their own roles for various cardiovascular issues we can discuss with another session. Anyways, diuretics have their own significant dehydration effect. So we do have also another class of drug called apremilast for a skin disorder called plaque psoriasis. So as you can see in the slide, this inflammatory illness, disease of the skin, can be treated by a drug called apremilast. Is a tablet that improves moderate to severe psoriasis by targeting a specific enzyme that reduces inflammation. So what's important is one of the most common side effects for this drug is diarrhea, which becomes severe enough to send patients to the hospital. So reports or studies show that this drug has some reported diarrhea. So if there is diarrhea, we should look for drugs for cancer or other causes for dehydration. So chemotherapy is frequently used to treat cancer, and these drugs come with a host of side effects, including nausea and vomiting. Nausea and vomiting. So these are the common side effects with most of the anti-cancer drugs. So what's important is if there is nausea and vomiting, majority of the anti-cancer drugs cause severe nausea and vomiting. This can be treated actually with anti-nausea, anti-vomiting drugs actually. So if there is nausea and vomiting, we should look for dehydration, possible dehydration, and to drink some enough amount of fluid or water is very. Another drug is lithium. This drug is a mood stabilizer used for bipolar disorders. So lithium, whenever a patient takes lithium, it causes increased urination. If there is increased urination, it's obvious that large amount of diluted urine will be here. Water will be lost, and we should look for. And as a summary for today's session, most people are adequately hydrated as long as they consume water as their trust guides them. For this reason, it is best to listen to your body. You don't need to count how many glasses of water you are drinking, be it on drugs or not. Your body guides how much amount of water you should drink actually. It's a guidance, your trust. Thank you for watching or listening. Thank you. Bye for today.